Hello friends, in this video we are going to talk about the heparin versus warfarin. Okay, so first chemistry. Heparin is a mucopolysaccharide while the warfarin is a coumarin derivative. Sources heparin sources natural such as oak, lung and pig intestine while the warfarin is synthetic route of administration. Heparin is given parenteral, intravenous or subcutaneous while the warfarin is will given oral. Okay, onset of action. Heparin onset of action is immediate because due to its mechanism of action. Heparin basically activates the antithrombin 3, 83, which will further inhibit the factor 10A and in higher doses also inhibit the factor 2. Basically, there is a pentasaccharide sequence in the heparin which will make the conformational change in the 83 which will induce the inhibition of factor 10A, and it also provides some of the heparin molecule also provides scaffolding. So it is at higher doses and bigger. It is a bigger molecule which provides scaffolding. So it will inactivate factor 10A and as well as factor 2A. So that's how heparin acts, and we get an immediate effect. So to summarize, what does the heparin do? Will activate 83, which will inhibit the factor 10A at lower dose. Okay, while inhibit factor 2A at higher doses. Sorry, at higher doses. Okay, it requires the APTT monitoring. Heparin requires APTT monitoring. So you have to know at least these things about the heparin. Okay, so now let's get back to the difference. While the warfarin action is delayed, warfarin will inhibit vitamin K epoxide reductase. Okay, it will inhibit this enzyme. So already there is vitamin K available, which is previously made. So they will be used to make the clotting factors. As they over, we have already inhibited this enzyme. So further vitamin K will not be available for the carboxylation of the required factors for clotting in the liver. So here is the mechanism. Factor 7, 9 and 10 will require carboxylation for the for clotting ability. Okay, so now what happens that vitamin K hydroquinone will be used to carboxylate the is required for gamma glutamyl carboxylase for carboxylation of this factor 7, 9 and 10. Okay, and it will convert it to vitamin K epoxide, and vitamin K epoxide will further convert it to vitamin K hydroquinone, which is needed for the procedure of clotting is converted by vitamin K epoxide reductase. So warfarin basically inhibit this enzyme. So vitamin K hydroquinone or oxidized version of the vitamin K is not available for carboxylation. So this is the mechanism of warfarin. Okay. So duration of action 4 to 6 hours, while the warfarin takes 3 to 6 days to act. Okay. Activity heparin will act in vitro as well as in vivo, while the warfarin only acts in vivo only. Okay. Here the mechanism we have talked earlier: blocks action of factor 10 and thrombin. Factor 10 at lower doses, while thrombin at higher doses. Inhibit synthesis of clotting factors. Antagonist is protamine sulfate and warfarin vitamin K. Variability in response limited, while the warfarin is marked. Lab control APTT monitoring is required in heparin, as we have talked earlier. And in the warfarin prothrombin time, an internalized normalized ratio is needed. International normalized ratio is needed. So what is international normalized ratio? International normalized ratio is equal to prothrombin time of the patient divided by the prothrombin time of reference sample. Okay, and the ISI stands for International Sensitivity Index. Okay, so this is about the international normalized ratio. Okay, drug interaction few and not significant in the heparin, while there are many drug interaction between warfarin and other drugs used to initiate therapy because it has immediate effect, and warfarin is for maintenance. Heparin can be used in pregnancy. Heparin can be used in pregnancy. Sorry, while warfarin is contraindicated in pregnancy. Contraindicated in pregnancy. Okay, it will limit to the fetus. So this is about the heparin versus warfarin. Okay, thanks for watching.